I struggle with chronic migraines. So migraines are extremely bad. There's only one pill that really kicks in to make it stop.
Reproductive and sexual health, stress relief, car and driving safety, and gang violence, and drugs.
The only way I can really get my migraines to be better is if I fall asleep or if I eat. Sometimes I even have to throw up before it starts feeling better.
There's kids that are stressed with school and they want to come and talk to someone, but some kids try and talk to their parents and their parents aren't acceptable. They think they're being dramatic. So they'll come here and it's a safe place and it's confidential. And that just helps kids a lot, just knowing you can talk to someone in a safe place.
Well, our goal is to make sure that all the children in Adams County have access to affordable health care through our partnership with schools, school districts, and community partners. And our goal is to keep students healthy today and for all of their tomorrows. We're a basic primary care facility, so we can do any variety of acute reasons, so an injury from sports or strep throat, flu, any kind of minor acute needs. We also do full well care, and so we'll do physicals, and then depending on the need, we manage a variety of chronic conditions from ADHD, asthma, obesity, and then we do a lot of education. I think being a primary care organization, especially with adolescents, you can't do too much education, and I think utilizing nurse practitioners as our providers, as well as having the behavioral health professionals, really helps with that.
I'm the nurse practitioner here at Kids First, and so I see patients. I've had kids coming in who, can't stop coughing and they're having trouble breathing, and being able to give them breathing treatments here, make sure that they have medication. On our side, we're able to screen those kids and identify issues that may not have been identified. We do a pretty in-depth screening on anxiety, depression, and also substance abuse, as well as sexual activity.
It's really nice for us to be able to have that resource so that we can have open conversations with kids and make sure that they're supported. Unfortunately, teen suicide is something that we definitely deal with on a regular basis, and so making sure that the students have a safe place to go and safe people to talk to is number one, and that's our number one goal, is to know that they have a safe place to come where there's no judgment.
So my name's Maria Zubia. I'm the Director of Community Outreach, and so the beauty of what we do is that who can you tell that it's going to keep everything confidential anyways? Your doctor, that's who you come and that's who you tell, I'm struggling with this, or, I didn't have uniforms for my kids this year for school, or I need school supplies, or I need diapers for my child. That's who you open up to. So who better to help you meet that need than someone that you already trust? When your child's sick, they're not learning. How can they learn if they're sick? Well, if they're hungry, they're not learning. If they're worried about their parents' immigration status, they're not learning.
We really make a difference, and if we didn't have the support from the donors and funders and supporters out there, we would not be able to do the work that we do, and it would be a big loss to our community.
So we have to help the families however we can to make sure that the kids get what they need, because our mission is really to serve the children.
You can go to our website, kidsfirsthealthcare.org, and click on the donate button.
If anything else, I just recommend the clinic, because you guys usually get on top of it right away.